Carla, this is Nova, your nurse for today. How are you?
I'm good.
Great. Can you state your name and date of birth for me, please?
My name is on August 3rd, 2005.
Thank you. So I'll be performing a chest and heart assessment today. So first off, I'll start by assessing your neck and the vessels in your neck, palpating your carotid artery and listening to it as well. So let's start doing that. So first off, with the bell of my stethoscope, I'm going to be listening to her carotid artery for any bruits or abnormal sounds. So I'll be starting off with the angle of her jaw down here, then her mid-cervical area, and then the base of her neck. So I'll just start off with the bell and just stethoscope. I'm gonna ask you to breathe in and breathe out and hold it. Okay, hold it. Again, breathe in, out, hold it. Good. Again, out, hold it. Good. So I didn't hear any abnormal sounds or any bruise on this side of her neck. So now I'm going to her right side, and same thing. Breathe in, out, hold it. Good. Again, out, hold it. Okay. Again, hold it. Okay. Same thing. No bruise, no abnormal sounds. So now I'm going to palpate her carotid artery, and with this we're going to be assessing the amplitude and the contour. So I'm going to put my fingers right here. Can you okay, right there? So I'm just going to feel your artery right. Okay. I'll grade it to be a 2+ because 2+ is normal, 1+ is diminishing, and 3 or 4+ is like a really hard pounding. Hers feels normal. I'll do the other side now. Okay. Same thing. Okay. She has no abnormal beats. Okay, so now we're going to assess the vessels in your neck for jugular distension. I'm gonna ask you to tilt your head to your left, like this. Expose your neck a little bit back. Okay, right there. It's fine. And this is for basically looking for increased central venous pressure. So I'm gonna need my pen light. So what we're trying to see here is basically her neck vessels, and they shouldn't be bulging or anything, because if they are bulging, that means that she has increased central venous pressure, and that's basically seen in patients with heart failure and certain conditions. So I'm just going to, okay. It should look kind of flat and not like overly bulging. So right here, you see it. I kind of see the beat a little bit, but it's not like really out. So it's good. Okay, so one thing I forgot to do before was to actually inspect the neck before palpating the carotid artery and doing the jugular venous distension. So I had to do that before. Now I'm gonna go on to inspecting her chest and listening to her heart sounds. So while I inspect her chest, I'm looking to see if she has any moles, any wounds, lesions, and also looking to see if she has to make like an effort to breathe if she's using labored breathing. And I see right here that she has a small mole, but I don't think it's a problem or anything because the borders are not crusty. The color looks normal. It's also symmetrical, so that's good. I'm also checking to see if she has any other lesions or wounds in the chest. And no, she doesn't. That's good. So now I'm gonna start to listen to her heart sounds. So I'm gonna do this at 5 points. It's gonna be the aortic, the pulmonic, Erb's point, tricuspid, and mitral valves. Up in the aortic valve, you could usually hear S2 a lot louder because it's at the base of the heart. And down at the mitral valve, which is also called the PMI or point of maximal impulse, you can listen to the S1 a lot louder than in any other place. And that's also where you can get the apical pulse, which I'll do later on. So I'm gonna listen to her heart sounds using the diaphragm or the stethoscope first. I'm listening for lub-dub, so I'll start at the aortic. Okay, I hear lub-dub, that's good. Now I'm gonna go to the pulmonic. Okay. Now Erb's point. The tricuspid. And then the mitral. Can you sit straight a little bit? Okay. So I should actually do this. It would be better, a lot better without a shirt. So you could, so you won't have any interruptions when you're listening to the heart sounds or anything. But for the sake of patient privacy, I'm just gonna keep her shirt on and try to listen like that. So it'll be, her mitral would be right here. Okay, she has a good heartbeat, I can hear it. So I'm gonna take the apical pulse right now. For a minute. Okay. Okay, so I cut it down to 30 seconds, but her apical pulse is actually 72. So that's normal because it should be from 60 to 100 beats per minute, which is normal. Now I'm going to listen to her heart rate and rhythm. She has a pretty good rhythm. I hear lub-dub, lub-dub, lub-dub. Seems normal. Now her heart rate. We'll take it for a full minute as well. Okay, breathe in now. Okay, so I also cut it down to 30 seconds, but her heart rate is 82, which is also normal. Now I'm gonna listen to her heart sounds again, but with the bell of the stethoscope, and this is to see if she has like any murmurs or any abnormal sounds. So I'm gonna do it at the exact same 5 locations again. Can you lean a little bit forward? Sit up straight. Straight, like this. Okay, good. Okay. So I didn't hear any murmurs or any extra heart sounds, so that's good. Now I'm gonna do chest expansion, and this is basically to see if both sides of the chest are equal to each other, or if one is like raises higher than the other when she breathes in and out. So I'm just gonna put my hand here. Take a deep breath in and out. Again. Okay, so both sides of the chest are equal because my hands went equally up and down like that. Okay, so now I'm gonna listen to her lung sounds, and I'm gonna start at above the clavicle on both sides first to compare them, and I'm just gonna work my way down to the upper lobes and then down to the lower lobes of the lungs on both sides. And I'm gonna do this to see if I hear like any abnormal breath sounds, like a stridor, wheezing, crackles, or whatever the case may be. So I'm just gonna start doing that. Take a deep breath in and out. Okay. I'm gonna go down to the upper lobes. Okay. Can you stand up for me, please? You should actually do this sitting down, but for the sake of, because the chair is too low, I'm just gonna do it standing up so I can have a better, I can reach better. So I'm just gonna go in here, breathe in. This should also be done without a shirt because it can interfere with your sound, with your hearing, but for the sake of patient privacy, I'm just keeping her shirt on. Okay, a little bit back here. Breathe in. Okay, good. Good, sit down. So I didn't hear any crackles, any wheezing, stridors, and I didn't hear any obstruction, so her airway is pretty clear. I'm just gonna listen to the back part of her lungs. I'm gonna start up at the apex, and I'm just gonna progress down between the scapula all the way down to the upper and lower lobes of the lungs. Breathe. below mid-axillary, so lift your arm up a little bit. Okay. This side. Okay. So her lungs sound pretty clear. I didn't hear any crackling, wheezing, or any stridors, or any abnormal breath sound. Okay, so now I'm gonna percuss her chest and her lungs. Can you stand up for me? Okay. So what I should be hearing is resonance, and like for both sides to be equal. So I'm just gonna start by percussing her chest. And I'm hearing that it's not dull, it's resonant. Okay, good. Turn around. Now I'm gonna do her lungs. Okay, good. Now I'm gonna do her lungs. So I'm just gonna percuss like in between her scapula. I'm hearing that resonance. Okay, it's resonant on both sides, and I would just progress down, but because she has a shirt on, I might not be able to hear correctly. Okay, you can sit down now. Okay, so that's all I have for today. Thank you for participating and being a good patient, and